Yes, well, I think that everyone acknowledges that there is a wealth of data on MRD in myeloma, but we should remember that most of the data was generated either in newly diagnosed or relapsed refractory myeloma before the incorporation of CAR T cells and T cell engagers. And therefore the role of MRD in patients treated with these immunotherapies is virtually unknown. And this is why we felt it was important to perform this kind of analysis, the role of MRD in patients treated with CAR T cells and T cell engagers, to understand what it may offer. And I would say that the abstract and the results are both positive and negative. They are positive in such a way that we show that depth of response, defined both by CR and MRD negativity, is the most relevant and independent prognostic factor in these patients, and it outperforms extramedullary disease, the number of prior lines of therapy, as well as cytogenetic risk. So it remains important. However, I should confess that the results of a patient with a negative MRD test in this scenario are not as good as we are seeing in other scenarios. So therefore, this should make us think on alternatives and new approaches from the methodological point of view to make MRD more informative. And honestly, or personally, I think that the solution might be on a more minimally invasive, blood-based MRD assessment.